It's 10:02 a.m. and we are starting the meeting of the Notice of Funding Opportunity related to the Community Mental Health Substance Use Prevention and Crisis Services. You will have 3 panelists today that will be providing information. That includes myself, Don Yohe, who is the Interim Bureau Chief and Clinical Program Planner for the Mental Health Block Grant Funds, and of course, Dr. Stephanie Woodard, the Senior Policy Advisor to the Director on Behavioral Health. As part of all funding opportunities, there is one single point of contact. So at the end of the slideshow today, which will be posted on the web, we will have question and answers, and you will also have my contact information. So any follow-up questions or follow-up technical, you'll need to reach out to me directly. Based on the information we provide today, if you already have an application in and you feel like you would have made it stronger or better or different based on the information presented, you can certainly send me a note and request to have it retracted. I will let you know that we do have all the applications that have been received to date are currently under review. The next set of applications will continue in that review process. Today, we cannot discuss questions to specific projects, but really looking to provide an overview of technical information and guidance in terms of what you need and don't need or eligibility for the application. So I'm just going to make sure that start this so just kind of already went over this part. So the mission and purpose, the Nevada Division of Public and Behavioral Health's mission is to protect, promote, and improve the physical and behavioral health of people in Nevada. I'm not going to read every slide word for word, but it just kind of lets you know that it's under the Bureau of Health, Wellness, and Prevention that is focused on behavioral health, and that includes the block grant supplemental dollars for substance use mental health direct services. This also includes crisis services for the state of Nevada, of which Dr. Woodard leads those efforts. Each funding source is specific on what is and isn't allowed. And so as you saw within the NOFO, some of those specific requirements are either part of the crisis system, the SAMHSA, the grant, or the limitations based on needs assessments within the state of Nevada. All proposals or any proposal submitted as part of this must provide the essential services or gaps that prevent individual from accessing or participating in behavioral health programs. This is not meant to replace any funds for current programs that you have. As the amendment to the NOFO showed, the application deadline has been extended. So an application has to be submitted on or before January 31st, 2022 at 5 p.m. Pacific Standard Time. There are no exceptions to this. So if there are any computer errors or email errors or that sort of thing, it'll be based on the time the email was sent. I have been attempting to provide notice to individuals who have submitted within 48 hours that they that their application was or was not received. Just to share, I will be on vacation for 4 or 5 days. I will try to respond to individual during that time, but there might be a little bit delay in sharing that information. Who can apply? Public or government agencies. This includes schools, any agency that is really equipped to do the services that are identified in the notice. Private practices or associations, tribal organizations, limited liability partnerships, sole providers, nonprofit providers, foundations. We really don't have any exclusions. The exclusionary criteria comes in terms of whether or not you are licensed and you have a business license and the mandatory minimum requirements to operate within the state of Nevada. The application process. There are 2 documents that are required to be submitted, and DPPH, DHHS the entire department has been working on streamlining applications and not requiring applicants to complete the level of detail that the state has to complete when applying for federal applications. For those of you who are familiar with the federal applications, it can be a little daunting. So what we did was we've created an actual application form. And then of course, we still have to get a budget. So we have the budget form. That application form needs to be completed. And if there are any sections that are not applicable, we still need something noted in those sections. When you submit those documents, you submit them via email form. So you submit the application and the Excel to my address, Sheila Lambert at slambert@dhhs.nv.gov, again, on or before that date. I know that many of you have additional materials you would like to submit, but we're really looking for a very concise and a very directed program. And we do reserve the opportunity to reach out to you for additional material, additional questions as we move along. So it would be at that time that you may provide, that we may ask for additional materials. If they are included, you may be disqualified. The key considerations for applying. So each funding area has the minimum criteria that is identified and very specific elements to it. One, can you meet that minimum criteria of that funding area? Can you develop a new program, expand or enhance an existing program under the minimum criteria? So even if you have an existing program and you want to expand or enhance it, but it doesn't meet the minimum criteria, you're going to be required to utilize that minimum criteria and the expansion or enhancement. And so that's a question that you will need to determine on a go, no go for the application. Have you addressed how the program will be sustainable? There is a variety of funds being used, but many of the funds that we're looking at now are ARPA funds, which end in 2 to 3 years. So is it a program that there will be a way for sustainability beyond that time frame? Are you prepared to meet the fidelity of the evidence-based program models? Each applicant in the questions will have to identify which evidence-based program that they are utilizing, rather that is cognitive behavioral therapy, rather that is peer-to-peer, but it has to be a specific, and it really needs to meet the fidelity. We are bringing on quality assurance personnel, and those personnel are going to be working with our providers to ensure that fidelity is maintained. Do you have the capacity to collect data and report on services? Do you have electronic health records? Do you have a data system? What are you doing to ensure that the number of clients you are serving can be attributed to the work under the program? Of course, the target populations for most of the category areas, we do have a few exceptions in terms of some of the workforce or other, but most of the funding will go to children with SED, SUD and their families, adults with SMI, SUD or co-occurring, and or both. If you select both populations to serve, you need to address the evidence-based or best practices that are specific to your populations of focus. So if you are serving more than one population of focus, you need to include all of those. Also, the assessment documents and the evaluation tools that are to be utilized must be those that are appropriate under SAMHSA and the Medicaid State Manual. Those include the ASAM, LOCUS, CASI. Funding priority areas. We have the adult mobile crisis or crisis response teams, assertive community treatment, ACT, or the forensic assertive community treatment, FACT, hospital crisis stabilization units. You'll note for section C that you must be a freestanding psychiatric center or hospital. Number D, expansion of peer recovery reports and services and workforce development, adult or justice deflection and diversion, assisted outpatient, community-based treatment for children, youth, and families, prevention programming, pregnant women and women with dependent children, early serious mental illness. Children's mobile crisis teams was added during the next 4 criteria areas were added in an amendment. Children's mobile crisis teams, 24/7 telehealth services for rural and frontier law enforcement crisis services, virtual care, crisis care, workforce development, and community collective impact leadership. On the section M for workforce development and section N, the community collective impact, they require a different process for submitting an application. The state is looking for innovative projects to address the needs. So there are specific questions that are identified within the NOFO, and you would send a letter of interest plus the response to those questions not to exceed 15 pages, and still submit the same way by sending those through email to my address. Application J, K, and L. On this J, the sustainability. So we've had a couple of questions in terms of what sustainability means, and that it can mean a variety of things, including factors such as Medicaid eligibility or other third-party liability, such as private insurance or other payer service sources. This could mean that we have a new program that is going to, as part of their sustainability, become Medicaid eligible, or work towards other sort of payer sources depending on the project. We would need that information in that section J. In section K, it's really important that you're only going to select one. You will select either adults only, juveniles, or you will select both populations, but only click one box. For section L, the priority areas, again, the priority areas we went over, you may submit more than one application for a different priority area, but you may only submit one application for each priority area, and that has to be a separate application for each priority area. Here are some application notes to help you. Do not exceed the word count. Be specific and concise. The number of words that we have defined really make each applicant have to be very clear on what they are proposing. We are looking for you to be very direct and to know exactly what it is you want to accomplish. Be sure to answer all questions completely. When you are justifying your program on a needs assessment or you are identifying information, do not include national statistics. National statistics allowed SAMHSA to give us the additional dollars. Unless you are justifying a program where there are no state or specifics to your state or local statistics specific to your community. I don't believe that would be the case for many of these areas, but you may have a different take on a project, and we want to make sure that you're not just kind of repeating the information that's available nationally or that was available in the on the SAMHSA website. Evidence-based or best practices must be defined and how they will be implemented. We will not accept applications that are not based in evidence-based practices or best practices. Culturally and geographically inclusive projects are encouraged. Capacity should not be those who will not be part of the work effort. So when you're defining your organizational capacity, please do not include individuals who will not be doing any work on the project. We are really looking at who it is that the teams would be working with on a day-to-day basis, who it is who's going to be responsible for the data, for the reporting, and for management. Data collection is not optional. Failure to meet the data requirements may put a hold on your project or disqualify you for additional funding. In addition, if you don't submit the reports timely, or we are not getting data from you regularly, we reserve the right to terminate your grant if you have been selected. When you're working on your scope of work and identifying your program manager, collecting data is not a performance measure. Performance measure is what you're going to do with that data. If you are looking at expanding services, we would want your current baseline. For example, if you are currently serving 100 people and the expansion you expect to serve 25% more, then you would be serving 125 people in 1 year. The 25% more is what you're looking to expand. The program manager needs to be the individual who is responsible to the work, gets it complete, and who will manage in the day-to-day efforts. This is our main contact. Many times we find that organizations put their executive director as the main contact. And the executive director is someone whom we work with infrequently as part of the day-to-day operations. DHHS policies and procedures will manage the efforts of the program and will be the guiding documents. Just because it might be federally allowed, or it may have been used in another state, or a process may be part of your organization, the DHHS policies and procedure and GERS manual will be the guiding documents for Nevada and for this project, and these will be the ones that will be the controlling documents. The applicants must be able to meet with the state funder monthly and the progress reports will be required not less than quarterly. In some cases, that may be monthly. The applicant is required to have all of the license certifications, everything that is applicable for the services that you are requesting. Applications will be disqualified if they do not have a federal tax ID number, which is to ensure that you are an operational entity and that you have that federal tax ID, or if you do not have a DUNS number. The DUNS number is now being changed by the federal to also be called a unique. It's a unique something number. It's called a UEI. They are synonymous, and you can get that at grants.gov, but those have to be completed prior to applications, and they take less than 72 hours. Applicants are required to submit a budget based on 1 year. That may be extended to 2 years. This was not really clear, and for those who have already submitted applications who may have put in 2 years, who may put in 18 months based on the expected time frame, that is not a problem. We're still going to look at your first year of funding, and we will work with you on budget adjustments. Supplanting versus supplementing equals disqualification. What is supplanting? Supplanting is taking new money to pay for existing services or existing staff. Supplementing is adding additional staff to reach more people, thus enhancing access to services. So if you have existing funding and you are funding a staff full-time, supplanting would be using this money to fund them for the same services. In terms of the application grading, the capacity and sustainability, the abstract, you can look at this list that kind of gives you an idea of what the totals are. If you have a state headquarters within the state of Nevada, you do get 5 additional bonus points outside, because we do want to promote those Nevada organizations. That does not mean to say that other organizations cannot apply or are not currently providing services in Nevada. But if they are providing services in Nevada, that 5 additional bonus points is available. We will, to link to the application, we've included that in there. And then that includes, if we click on it and we link, if it works. Let's see. Stop this share for a second and start the other share again to show the site. So as you can see, this particular screen, you can see where the NOFO instructions are, the budget form, the application form. You can review questions and answers that were submitted the first time. You can see both an Amendment 1 and Amendment 2 that leads us to where we're at today. So we would encourage you to read all that information as part of that process. Now I want to turn it over to Dr. Woodard to discuss a little bit about the differences in processes with submitting with our office and the governor's office.
Thank you, Sheila. I just want to take a moment to say good morning to everyone and welcome you all to the webinar today. As Sheila mentioned, the Notice of Funding opportunity is making available federal COVID and ARPA funds that were allocated to states through our block grants. As such, these dollars are really targeted from the federal government to states to address existing needs and gaps within our behavioral health system. We have some required funding announcements that are included in the NOFO for specific set-asides that are dictated to states. We also had a considerable amount of flexibility when we were developing this Notice of Funding opportunity and really took in a lot of information from the Children's Behavioral Health Consortia, the Regional Behavioral Health Policy Boards, the Commission on Behavioral Health, community stakeholders, families, as well as individuals who are in need of services and make use of services to gear the Notice of Funding opportunity to address the known needs and gaps within Nevada specifically. We've been working closely with the governor's office to ensure that we are not duplicating efforts when it comes to ensuring that we have dollars infused into communities to address those known needs and gaps as it relates to behavioral health. So some of you may have been contacted over the last couple of weeks notifying you that an ARPA request through the governor's office has been identified as in whole or in part potentially qualifying for this notice of funding opportunity. We have done that in an effort to make sure that we are not duplicating funding efforts and allow you to potentially make use of some of these additional federal funds to support your activities. If you have questions as it relates to the recommendation to review and potentially apply for the notice of funding opportunity, you can reach out to Sheila. She has information related to the application to the governor's office. And we have been able to flag some of those potential projects. We encourage you, if you've been contacted because a project that you had proposed through the governor's office for ARPA funds could meet the qualifications for this notice of funding opportunity, to really consider applying for the notice. This will again allow us as a state to ensure that we are getting the federal dollars to the providers in the communities to be able to do a multitude of activities, and that we are really prioritizing this notice of funding opportunity and these federal appropriated ARPA dollars specifically to address the known needs as it relates to behavioral health in our state. Sheila, is there anything else you wanted to make sure was mentioned?
No, I think it's a great time to open up for questions and answers. I'll read the question and then we'll provide the answers. I'll be providing the technical answers and Dr. Woodard will be responding to probably the rest of them. Does a sole provider need a business license as well then? If a sole proprietor needs to be licensed in the state of Nevada to operate, yes. I submitted multiple suggestions to the governor's office for the ARPA funding, but in the first email, there was no indication of which suggestion was identified as a good fit. Could you please tell me which suggestion you are referring to? If you submitted multiple applications to the governor's office for ARPA, the good fit would be those that would fit under the funding criteria submitted within our NOFO. So if you look at the list of our priority areas and that one of your applications fit within those priority areas, that would be the application you would also want to submit to for this NOFO, correct, Stephanie?
That's correct.
Is the Excel budget form required for the workforce development grant? Great question. That was not included. Yes, please. We would like to know not only what your plan is for section M, but also what the cost is. There should be, it should have been very clear, and it wasn't. The Excel, the budget request would be submitted with every application. I also want to clarify that it's very rarely that a budget as submitted is approved. So the department, the agency knows that there are a lot of intricacies with different federal funding dollars. And so we work with you to massage that budget to meet the objectives of what the criteria is and to make sure that they're allowable and that it fits within the criteria. So do your very best, and then we will work with you on letting you know what can be and can't be. So I don't want the budget form to scare somebody off. We want you to do your what you think you need, and then in some cases we'll let you know what's not required. As an example, what is not an allowable, which we see sometimes, is marketing. Marketing is not an allowable. You cannot pay for a marketing position out of federal funds. That is not an allowable position. So if you've submitted an application that includes that, we would work with you and let you know that that specific position is not allowed. Narrowly defined target population: child, SED, SUD, COD, ID, DD, ESMI, FEP, adult, SMI, SUD, ID, DD, ESMI, FEP. Point of clarification. To qualify to be served with this funding, must all target populations be diagnosable with SUD or substantial mental health disorders? In other words, do any programs in the NOFO amendment allow for other target populations, for example, those experiencing crisis related to grief, loss, trauma, victimization?
Sheila, I can take this one if you'd like. So in addition to the amendment, there is the original notice of funding opportunity. So all of these populations are very clearly defined, and many of them are defined consistent with federal statute. The exception to requiring a diagnosed or diagnosable behavioral health condition is for some of the crisis services that have also been included in the notice of funding opportunity. So I would look very closely at each of those services, and under the description of each of those services is an identification of the target populations for which those services are most appropriate. So unless it specifically states that an individual needs an SMI or SED diagnosis or meets any of the other diagnostic criteria, and it relates to a crisis service, the individual will only need to be classified as being in crisis.
I think this next one is for you as well, Dr. Woodard. Who needs to be SAPTA certified? What if we are not currently SAPTA certified?
SAPTA certification is required for all outpatient and residential substance use treatment providers. This is consistent with NAC 458. And requires those providers that are receiving funding to be certified. This would allow a provider who is currently not certified to pursue certification as part of the grant activities, and would be required within 6 months of the grant beginning.
Are direct services just considered services such as counseling? We offer group programming for most of what we offer. I wasn't sure if that was included under direct services.
So Sheila, I can take this one as well. Just want to reiterate to read very carefully in each of the programming categories where it delineates the minimum standards or minimum activities that have to be conducted within each of the categories. Certainly different modalities for providing behavioral health services are allowed and encouraged.
If I wanted to submit a proposal that serves the target population and is using a SAMHSA supported best practice, but are not the specific activities, would an application be reviewed? Mine would be a new service not currently existing and would address a known gap. So I'm going to read that one again. So if I submit a proposal that serves the target population and is using a SAMHSA supported best practice, but are not the specific activities, so the suggested activities that we wrote into the application, would an application be reviewed?
At this time, I would say that the only applications that would be eligible for review and consideration would be those applications that meet the specific minimum criteria for the programs that have been outlined specifically in the notice of funding opportunity.
What recommendations do you have for first-time applicants? This is a question we get very often because we really do want more people to apply for grants. We really do want to, expand the number of service providers we have throughout the state. And I would tell you that that's one of the reasons that we took a lot of time to streamline the application process so that it was more like a job interview where you were answering yes or no, or you were checking boxes, and we put in very specific questions so that you did not have to guess what information we were looking for. So as you would do as if you were filling out for a driver's license, or as you were filling out for a new job interview, I would just say the best recommendations is to make sure that whatever service area you are looking at, you have read it several times, and that you answer every question in the application. Don't assume that just because the answer might be no or not applicable, that you would be disqualified. If there are really strong programs out there that meet a gap that other applications don't meet, you may be considered as a startup project. So just take your time. There's this, it's a easy application, but just don't hasten through it. Do you have anything you want to add to that, Stephanie? Dr. Woodard, sorry.
It's okay. The only other thing that I would add is this is really an opportunity, especially if you are a new applicant, to help the review committee really understand who you are and what your agency does, what you've had experience being able to provide, and that you have the requisite skills to be able to complete the project that you are proposing. We really enjoy new applications from new providers, getting to know what other people are doing in the community, and really welcome new applicants to come to the table and propose projects that would fit with the notice of funding opportunity. So just take this as an opportunity to give us information to get to know you and your program, and what it is that you have experience doing, and help to instill some confidence in us that you have what it takes to successfully complete the project you're proposing.
Does the company have to be in operations for several previous years, or is a company opened late in 2021 eligible? I believe we wrote in the application you must have at least 2 years of experience. So not sure that this would be the appropriate application for you at this time, but we would encourage you to stay engaged with us. Let us know what your services is, as well as other organizations come up or opportunities come up. Would you agree with that, Dr. Woodard?
I would, and the minimum of 2 years experience is really consistent with the standard that our federal funders have also established for similar programs, really making sure that programs have at least a foundation of providing, if not the same, similar services for the previous 2 years.
We currently have patients under our care in Nevada. The patient cohort is low at the moment, but we are projected to increase in 2022. As we are first-time applicants, how do we go about budgeting, projections, or current cohort? So this is not something we're going to be able to tell you what to do. You would need to get with your financial manager. What we would suggest is that you're looking at your census from times before, because we're going to want to know what your previous baselines were and what you expected your increase to be. We would also be looking at what your staffing was and what your staffing is going to be. So as you look at your budgeting and projections, those are just the 2 areas that are standardized that we could tell you to look at, but your actual projections and such will have to come from your individual organizations. You just mentioned marketing positions are not allowed. Does that include marketing materials for a new program too? Marketing materials are materials, depending on how it is written, could be allowable. So it would depend on which materials and what you're talking about specifically for the program. For G, community-based treatment for children, youth, and families of the original NOFO, one of the bullet points says utilize SAPTA certified provider. If we are not providing substance use disorder treatment and only providing SED for children and SMI for adults, do our providers need to be SAPTA certified? I'll leave that to you, Dr. Woodard.
So if there are services that are being provided for substance use disorder, then SAPTA certified providers are required to be used. But if they are targeting other populations such as SMI and SED, then the requirement would not hold.
For 24/7 emergency services, if we do 24/7 DBT phone coaching services for established patients, does this mean our organization would need to provide 24/7 emergency services for non-established patients? Dr. Woodard?
So I believe this is referring to the 24/7 telehealth services. And if that is the case, we are using this notice of funding opportunity to seek a vendor to be able to provide 24/7 telehealth support specifically to law enforcement. in response to crises. So if they are responding to a crisis, they would be enabled with an iPad or a tablet, and the telehealth provider would be able to provide 24/7 telehealth services to support their interventions. If we got that question wrong, please feel free to add a clarifying question in the chat, and we will definitely get back to it.
I just want to add that we did do this virtually because we know that we respond to some questions based on our interpretation. And sometimes it takes a couple questions of going back and forth in order to make sure you have what you need. So the next question, can these grant funds be utilized to provide supportive educational opportunities for children while their parents engage in treatment? The parents fall within the target population of adults with SUD.
So I can go ahead and answer that. I would review the existing program descriptions within the application to determine if any of them fit. Certainly, children and families of individuals, parents who are involved in substance use disorder treatment may be in need of additional interventions. And so if you are reading any of the sections, I would say specifically around the prevention programming that seem to fit the programming that you would like to propose, then an application could be submitted for consideration.
Next question, if I already submitted my application, do I need to resubmit? I was confused when I got the email on December 22nd. There are some applicants who submitted to both the governor's office as well as to the Division of Public and Behavioral Health. If you submitted one to each, no, you do not need to resubmit. If you've got the email and you only submitted to the governor's office, we would strongly encourage you to also submit as part of this funding announcement. Can master's or doctoral students who are trained by evidence-based providers and EBPs provide the services in each community-based treatment for children, youth, and families?
So I can answer this one, Sheila. There's no prohibition in using postdocs, interns, or practicum students in providing services. That being said, we do want to make sure that the services that are provided by anyone that is considered a trainee has the appropriate oversight and supervision. One of the other words that you will hear from us relatively frequently is sustainability. So if your program is selected for funding, we will begin very early on in the grant process to talk to you about how the services that you're providing could potentially be sustainable into the future. So just to be considering the utilization of behavioral health trainees and how that may have an impact on your ability to sustain program ongoing.
Clarification questions. Did I hear if we are not providing substance abuse treatment, SAPTA certification requirement does not hold?
So we do not currently have other certifications with the exception of assertive community treatment and supportive housing. So if you are proposing a project that would require those types of certifications, then additional certification through SAPTA would be required. Outside of that, if a certification doesn't currently exist, it would not be required as part of the deliverables for your grant.
Is DPPH open to proposals from organizations that do not currently provide services in Nevada? The answer is yes. How about informal caregiver of dementia patients at home and lack of access to mental health service? Would this be an appropriate topic of this grant?
At this time, we are not contemplating programs such as that, not to say that there is not a need, but unless it falls within the specific programs that have been identified in the notice of funding opportunity, it would not be eligible for consideration at this time.
I I don't understand this question, so I'm going to ask the individual who wrote this to resubmit a question, because it says, however, only allowable target populations are listed on page 18. So it's not really a question. So we're just going to kind of skip this one and ask if you could rephrase it for us and move to the next one. If a facility does not accept Medicaid or Medicaid, I believe it's Medicare or Medicaid, how does a facility receive referrals to use the grant funding? Dr. Woodard?
I'm not really clear on what the question is asking. Certainly, we do want providers to participate in the Medicaid and Medicare programs, specifically around conversations related to sustainability. But referrals for grant-funded programs would come to those programs similar to other community-based referrals.
For the workforce development area, is there a format for the LOI? No, it's just a one-page letter of interest plus the accompanying documents not to exceed 15 pages that address the questions that are identified under that section under the NOFO. The reason it is not similar to the program is because workforce development is such a broad and all-encompassing area that we know that there are subject matter experts in that area in the community that may provide a more innovative solution to some of the workforce challenges that we have in Nevada. So we basically set up questions to allow you to frame that in a way that we could look at as to if it would be appropriate and allowable under this funding opportunity. Can you provide written clarification on allowable targets per program? I'm going to assume that that's, can we provide written clarification on the allowable target populations per program? And I would ask that individual if they could clarify what they need. We have the target populations identified in the grant. But if you're talking about crisis services, we do have, if somebody is seeking crisis services, we do have an assumption, and I think I'll let Dr. Woodard talk about that a little bit more, where there might not be a diagnosis if they are accessing crisis services.
That's correct, and we do define individuals in crisis within the notice of funding opportunity as well.
In the NOFO, it looks like the prevention programming section is geared specifically to youth. Can you clarify, is prevention programming also acceptable to adults?
So I'll answer this one, Sheila. There are certain exceptions to youth prevention, and you will see in some of the language, we also include families as well as teachers, educators, and school staff, specifically for programs that help to support schools and students and families as they transition back to in-person learning.
The next question will be, who will be on the review committee? And I'm really excited to answer this one. The department and division not only has internal reviewers, but has also gone out, and we have external reviewers on the committee who are subject matter experts whose organizations are not submitting as part of the application, as well as higher education specialized people who specialize in specific areas to help review. We really wanted to make sure that we had a very robust review committees so that they could look at all of the elements as well as the entire state as a whole and bring their expertise when reviewing the applications. What is the requirement for letter of support from partner or collaborator? I'm assuming this is related to those two sections that have a different requirement than the rest of the grant. There is no specific requirement. It's if you do have a partner for the workforce development, we just need a letter of commitment. We're not looking for a letter of support. We're working for if this person is actually going to have a hand in some of the deliverables, we want a letter of commitment for them that they are willing to do that work hand in hand with you. So in most of our state and DPBH applications, letters of support are nice, but they really don't have any value except for it's great to see, it's great for us to see that you have wonderful partners. It's that letter of commitment for somebody who is actually doing the work with you that is really critical. If we submitted an application to the governor's office, does our application for the NOFO need to be the same if it was suggested we should apply for the NOFO? I'll leave this to you, Dr. Woodard.
So in reviewing applications to the governor's office for ARPA funds, we flagged those applications that either in entirety or in part could potentially qualify for the notice of funding opportunity. So we would encourage an application for the program as it was proposed to the governor's office with just careful consideration of which program type that proposal would fall best under in the notice of funding opportunity.
Next question, are services allowed for Nevada residents with age 65 or older? There is no age limits on these applications, so yes. For 24/7 emergency services in the community, in community-based services G, if we do 24/7 DBT phone coaching services for established patients, does this count as 24/7 emergency services? And are we required to do the 24/7 emergency services for the non-established patients? I think this was the question before, Dr. Woodard, but it was specific to community-based services.
So it's a great question. I would actually need to go back in and review the minimum qualifications or standards to be able to answer that. So let me go back and review, and then we will get you an answer.
Do you have any training or know of any in getting certified SAPTA program?
Can you repeat that question, Sheila?
I think they're asking how would they become certified SAPTA? How would they become a certified SAPTA program?
So we have a lot of information on becoming a SAPTA certified program on our website for you to review. In addition to that, you can email the point of contact on our website for the application. Typically, once an application is submitted, it is submitted to the division in the Bureau of Behavioral Health, Wellness, and Prevention. And then we work with our contractor, the University of Nevada, Reno, CASAT, so the Center for Applied Substance Abuse Technologies, to engage providers in working towards certification. This typically includes technical assistance as well as training if needed on developing policies and procedures and ensuring that you have all of the minimum qualifications established as you move through the certification process.
Can you give us an example of a community collective impact? I'll leave that one to you, Dr. Woodard.
So I would say Google is probably a great way for you to learn more about collective impact. Collective impact is a way that communities have been able to arrange a number of different kinds of providers and programs and supporters of a specific initiative, with the idea that many individuals or programs want to be able to contribute in some way, shape, or form to an initiative, but they themselves cannot carry the entire weight of seeing that initiative through to completion. And so collective impact is about identifying a number of different stakeholders that can all come together with very specific goals in mind and work collaboratively to make sure that those programs are implemented with success. For the backbone organizations for collective impact that are in the notice of funding opportunity here, we really are seeking organizations at a community level that can help to collaborate and coordinate a number of outpatient and inpatient behavioral health programs, really to support the needs of each of those communities.
Under the workforce development category, 2 questions. First one, can there be multiple applications from the same university? Yes. The second question, I'll leave this for Dr. Woodard. The first paragraph could read that developed training for crisis-based programs is only to be provided to mobile to mobile crisis stabilization and specialized community treatment programs. Is that how it should be interpreted?
Yes, that's an accurate interpretation.
Under section F, prevention, we hope to work with the schools. Not all of the students have diagnosable conditions, but all have been impacted by the pandemic and many are living in crisis. Would this school-wide service align with the grant's objectives? How can school-based mental health providers contribute if they hold licenses by the Nevada Department of Education?
So true to prevention programming, a diagnosis is not required for any student to receive those prevention interventions. And it would depend on the program that you're proposing as it relates to how behavioral health providers within the schools could potentially be utilized in the program that you're proposing. So I wouldn't have enough information to be able to really provide a lot of detail on how you would utilize school-based mental health professionals, but they certainly could be included in programming within a school setting.
The area that seems most relevant to our organization is prevention program, as far as the work that we do with resilience and suicide prevention. It looked as though that section was aimed predominantly towards youth, and our services are provided for physicians. Can the funds for prevention programming be used for other population gaps like physicians?
So the way that the notification for funding has been written is a predominant focus on youth. That being said, we do also recognize that there are needs in our communities for additional prevention programming. An application, while it may not fit specifically in this notice of funding opportunity, but does meet critical needs and gaps within the community, could be submitted, and it may not be considered for this round of funding, but as additional funding does become available to the state, we are using applications that come in through this notice of funding opportunity to potentially qualify for those other funds. Sheila, is there anything else you want to add to that?
Just that this NOFO can be used for up to 4 years. So if you're not selected and you have a program that did not quite fit with the limitation of funding that we have, just like Dr. Woodard said, for up to 4 years, it will stay on file. And I think that kind of fits in with the next question is, if we are unable to provide all caps, ALL, minimum requirements under the category we are applying, should we still apply? I think there's 2 parts to that question. One is, are you able to tell us how you could meet all the minimum requirements within a specific period of time? And then the second part that I would have before I turn it over to Dr. Woodard is that if you feel that you've got a really competitive application and it may be really close to fitting, we would encourage you to submit it based on that previous question. And then Dr. Woodard, do you want to add anything?
No, I think you answered that perfectly. Thank you.
Do I understand correctly that section N and M categories send a letter to Sheila's email along with the other documents? Yes, so for those particular 2, the application must include a letter of interest, define the target population. And so there are the specific criteria for both of those that have 6 or 7 questions. Those 6 or 7 questions need to be addressed in their entirety with that letter of interest. And that letter of interest, we're hoping kind of serves as an overview of what you are targeting and who your partners are. Does indirect cost rate follow main institution's predetermined rate? The state of Nevada will accept any audited indirect cost rate. We will make it very clear that you cannot ask for admin and indirect. Government agencies are not allowed to take an indirect cost rate. If the omnibus indirect cost rate, they should either have a cap or an audited indirect cost rate. But for universities, yes, we have accepted the university's rate. We typically look at that 26%. If you are looking at the on-site one, which is significantly higher, closer to 50%, then that would be a consideration of how many services we can reach. What is the average length of time for the division department to pay grantee organization reimbursement? So the policy is that we get reimbursement out within 2 weeks, less than that. We have had some staff shortages, and it also depends if you get your RFR, your request for reimbursement, incorrectly and timely. If we assume that you get your RFR incorrectly, from the date that we get it completed, you should have a reimbursement within 30 days. If there is back and forth in getting you to get that document complete, the time clock doesn't start until it actually finally gets submitted. So the only question that I see left is the one that we need to respond to. If the applicant who had wrote the question regarding the 24/7 emergency services and the community-based services G, if you could provide me your email, then what we will do is we will send that response to you in email. And the question, just so everyone knows, is for the 24/7 emergency services and the community-based services. If we do 24/7 D as in dog, B as in boy, T phone coaching services for established patients, does this count as doing 24/7 emergency services? And are we required to do 24/7 emergency services for non-established patients? I think on the second part is that you would only be, for community-based services, you would only be doing services for those, for community-based services that are your established clients. So the second part of that, I think we can answer, right, Dr. Woodard? And so really,
That's correct.
So if we're asking rather phone coaching services for their patients that you do 24/7 counts as 24/7 emergency services.
Yes, that would work. The requirement is not that you extend those services for 24/7 crisis access to your non-patient populations. We just want to make sure that when services are provided by providers, that any individuals or families that you are serving have access to you or some other method for their emergencies to be mitigated. So they do not use emergency rooms as an alternative.
So I think as we take a little bit more time with that one and broke that down, hopefully we've answered that correctly. If not, please send us another note. We're going to leave it open. We've left 2 hours and we're into 1 hour, and we have answered all 39 questions. So I want to just give a couple seconds, because that's the end of the questions, to see if anybody has any additional questions that maybe they were waiting to see if someone else asked and answered before they put their name in. As you noticed, we did not share the names, so we wanted to give people some privacy and the ability to answer questions anonymously, so that I know for myself, sometimes I even on regular calls, you wonder, is this a dumb question, or am I the only one not understanding it? And so in this way, there's a little bit of privacy, so that actually I'm the only one who will see the names, and the names are gone as soon as the answers are done. So we'll give it about 1 more minute, and then if we don't see any more questions, then we will close this webinar. If we are waiting from our business license from the state, can we still submit? A business license from the state takes about 7 to 10 days. So I would encourage you to submit by the time we review it. If by the time we review the application, you don't meet the minimum requirements, then you would be disqualified. But if you believe you have a competitive application, and you will have the minimum requirements of the DUNS and the EIN and the at least 2 years of service rather that outside of the state of Nevada, if you were looking at coming inside the state of Nevada, then we would accept that. We are so excited to see the number of participants that joined today. We hope this is helpful. If there are technical questions regarding to the submittal, I can respond to those via email. If it's about the program, then our question and answer period is closed, and I would not be able to respond to anything program related at this point in time, as all Q&A for that. Oh, excuse me, another question. Can we expect the UEI to be the new requirement coming April 2022? Yes, they are changing the DUNS to the UEI. It is pretty much the same, but yes, that will be the requirement because that's the federal requirement. So anytime our federal partners at OMB change the rules, we change our rules along with them because federal funding, we don't have a choice. It will take me a while it's been many years of using the word done. So it may take us a while to say UEI. So catch us in the future and correct us when we do that. Where can we go back and listen to this recording? This recording, my hope is to have it posted on the website today. This is my first time doing a webinar, so I do know that it is recorded and it has been downloading. So as soon as I can get with those individuals much smarter than me on how to do that, we will get that uploaded to the same site where we put all of the information for the SAMHSA information for the SAMHSA. With that, we wish you all, we're very excited to get your applications, and we wish you all a very great day. Thank you.
Thank you.